Hello and welcome everyone to the launch and webinar for the Mental Health and Our Changing Climate Children and Youth Report 2023. My name is Ben Fulgencio Turner, and I'm the Director of the Climate for Health program here at EcoAmerica. EcoAmerica's office is in our nation's capital, occupies the unceded lands of the Nacotchtank people. Roughly 4,163 American Indians live in present-day Washington, D.C. We uplift and uphold their sovereignty, history, and experiences, and are committed to working for climate justice that centers Indigenous peoples. To find out more about the Nacotchtank, we invite you to click on the link in the chat. We're glad you are here to learn more about the many ways that climate change impacts the mental health and well-being of children and young people, and especially the resources and solutions available to take climate action as a mental health imperative. Today, we're going to be sharing the findings from our new report, which is available now. The webinar includes an overview of the connections between climate change, physical and mental health, and some of our attitudes, beliefs, and behaviors when it comes to climate change. We'll discuss youth mental health in context of today's world and some of the other factors outside of climate change that are contributing to their well-being. Today, we'll cover the impacts of climate change on infants, children, youth, and young adults, as well as the inequitable impacts of climate change on the mental health of certain populations of children and youth, and the spectrum of solutions available to implement right now. We're going to hear directly from climate leader, activist, and storyteller, Aisha and Netta, who is a contributor to the report. And I want to add that if you need help, seek it out. There's a national helpline that offers 24/7 treatment, referral, and information for individuals and families facing mental or substance use disorders. We'll have time for questions at the end of the presentation. If you have a question, please submit it on the questions tab on Zoom, and our team will be sure to see it. This webinar is brought to you by the American Psychological Association and EcoAmerica. The American Psychological Association is the leading scientific and professional organization representing psychology in the United States, with more than 146,000 members. APA's mission is to promote the advancement, communication, and application of psychological science and knowledge to benefit society and improve lives. EcoAmerica is a nonprofit that moves society towards climate solutions by inspiring and empowering over 100 trusted national institutions and their millions of stakeholders in local communities across America to visibly act and advocate. Now I'll pass it over to our report co-author, Nicole Hill, to share a bit more about the report. Nicole?
Thank you, Ben. Hi, everyone. Thanks for joining. I'm going to tell you a little bit about the report. So it's intended to inform and empower mental health and other health professionals, community and elected leaders, educators, parents, advocates, and the public to understand and act on solutions to climate change that will ultimately support the mental health and well-being of children and youth. So a team of authors and editors led by the lead authors, Susan Clayton and Christy Manning, with Megan Spicer and myself, reviewed the body of literature on climate change and mental health and organized it in the report that we're presenting to you today. It has been through extensive peer review, and the report has over 200 citations. Today, you'll hear from the report's lead authors, plus Dr. Arthur Evans, who is the CEO and Executive Vice President of the American Psychological Association, and contributor and closer look author to the report, Aisha and Netta Brown. And now I'll pass it over to Dr. Arthur Evans for a word.
Hello, I'm Dr. Arthur Evans. I'm the Chief Executive Officer and Executive Vice President for the American Psychological Association. I want to thank you for joining us today for the release of this important report, Mental Health and Our Changing Climate, Children and Youth. I'm pleased to be a part of this work on such an important topic, climate change, and particularly how it is impacting mental health of our youth. We really have the confluence of two major issues happening right now. On the one hand, we have a youth mental health crisis, and on the other, global warming and climate change. Well, that's what makes this topic, the topic of this report, so relevant and urgent. The mental health of our youth in this country is a major concern right now. So this report couldn't come at a more important time. We're hearing more and more from our youth that they are concerned about climate change, and that is having an impact on their mental health. We know that the COVID-19 pandemic has ushered in a new set of challenges for our youth in the United States. But the reality is that children in the U.S. have been suffering for far longer than we've seen since the pandemic. For example, in the 10 years leading up to the pandemic, feelings of persistent sadness and hopelessness, as well as suicidal thoughts and behaviors, had increased by 40% among young people, according to the CDC. Well, this report is the fourth in a series of climate change reports we have authored with Eco America, but it's really the first to focus on youth. The report is intended for a wide range of people, including health and mental health professionals and institutions, climate and children's advocates, advocacy organizations, policymakers, youth, parents, educators, and many other interested entities and organizations. The report translates the research and knowledge for a broad audience, providing guidance and empowering people to take action. By releasing this report, we really hope to call attention to the role that climate change is playing in the youth mental health crisis. We need systems level solutions to tackle climate change at its root. We believe that psychology has a particularly important role to play as we help screen young people for climate-related stress and identify and administer treatments to build their resilience and meet their basic needs. We also believe that psychology can play a key role in helping to change the human behaviors that have resulted in the climate change that we're experiencing. We've had a strong partnership for many years, and we have seen the impressive impact of our collective work together on this issue of climate change. We at the APA are grateful for the opportunity to continue our work with Eco America to elevate this issue for healthcare professionals, policymakers, and the broader public, and to help have an impact on such a critical societal issue, particularly at this critical time in our country's history. So I want to thank you for the wonderful collaboration that we've had, and we're really looking forward to future work and collaboration on this important issue. Thank you.
Thank you, Dr. Evans, and I want to thank APA for a wonderful collaboration. Now we're going to offer a little bit of context before diving into the explicit impacts of climate change on mental health. The impacts of climate change intersect with and compound other factors that threaten youth mental health. We describe some of these below. In 2018, suicide was the leading cause of death for young people between 10 and 24 years old. And like Dr. Evans said, feelings of sadness and hopelessness increased by roughly 40% among young people in the 10 years that were leading up to COVID-19. Parental well-being and support can influence a child's mental health outcomes, and it can even act as a protective factor for their mental health. So children's mental health can be shaped largely by their family and household health. Some factors that influence youth mental health and well-being today include the COVID-19 pandemic. Pew Research found that during the pandemic, 58% of young adults faced high levels of psychological distress. And according to the CDC, 37% of high school students reported regular mental health struggles during that time. Racism and discrimination certainly influence mental health and well-being. The suicide rate among Black youth between the ages of 10 to 24 grew between 2018 and 2021 by 36.6%. While during the same years, the suicide rate among white young people went down by 3.9%. Racism deeply influences the health outcomes of children, and it's labeled as a social determinant of health. Additional social determinants of health include poverty, housing security, adequate nutrition, and access to medical care. And lastly, I'll say that other factors such as social media and gun violence are having impacts. But while the full list of factors is too long to dive into here today, we hope that a few of these can provide some context into the weight of the issues that young people are faced with, in addition to climate change. And now I'll pass it over to Eco America's Executive Director, Megan Spicer.
Thanks, Nicole. And thanks everyone for joining today. I'm going to discuss here some of the general impacts of climate change on mental health and how they can interact with the physical, mental, and community health. So the graphic you see, and also included in the report, shows that physical health, mental health, and community well-being are interconnected. The image highlights how inequities impact aspects of well-being, and also how family and household health play a role in the health outcomes of children. And so, although stress is a normal part of everyone's life, for young populations made vulnerable by social and economic circumstances, the stress of climate change takes a deeper toll. Individual physical and mental health outcomes are shaped not only by biology, but also by a range of social factors that intensify risk for some groups of people, such as educational opportunity, poverty, and access to safe housing. So in the report, we share highlights of key climate attitudes and concerns as a primer. And research in 2021 revealed that the perceived failure of governments to take action on climate change was, and still is, associated with distress amongst young people. The lack of government action leads people to believe that concern about climate change is low. However, it's important to note that concern about climate change is actually growing in the United States. Eco America found in our research in 2023 that 72% of Americans say they're concerned about climate change, including 45% who say they are very concerned. But only 14% of us think that people around us are very concerned. So the reality is that over 3 times as many people are very concerned about climate change than we think. And this gap in perceived concern can inhibit action on the issue, which is a phenomenon called pluralistic ignorance. The antidote is visible action on climate. Additionally, other research found that when thinking about climate change, 32% of people said they felt anxious, and 23% said they felt depressed. These are just a few of the many findings that contextualize how climate change is impacting our mental health today. Now I'm going to turn it over to Susan, Dr. Susan Clayton, who's going to start talking about the impacts of climate change on the mental health of our children and youth. Over to you, Susan.
Thanks, Megan. It's been such a privilege to work with Eco America on this important topic. To start, we want to highlight that climate change does not affect everyone equally. The effects of climate change depend not only on exposure, but also on pre-existing vulnerabilities, as well as on differences in sources of support. So groups vary in vulnerability because of many differences, including physiological differences, geographical differences, as well as social differences in power and resources. Economic disadvantage, for example, can determine the extent to which people can protect themselves from climate change, and also the extent to which they're exposed to hazards. For example, wealthier people are simply more likely to have air conditioning. They also are more likely to live in areas with more greenery and tree cover, which reduces the outdoor temperature by a significant amount. Communities of color are also more likely to live in more vulnerable areas, even when they're not economically disadvantaged, in part due to a history of redlining. The same is true of indigenous peoples who have often been displaced historically into areas subject to coastal erosion or permafrost thawing. They also often have cultural practices that are linked to the local ecosystem and local foods. So they may experience more social and emotional disruption when that ecosystem is altered or degraded. Women are more at risk because of physiological differences associated with reproduction and because of gender roles that may restrict mobility and access to information, and sexualized violence that often follows extreme weather events or forced migration. And other groups, as you see several listed here, may be vulnerable due to pre-existing factors that increase the impact of climate events or reduce their ability to respond. I want to now summarize some of the main threats of climate change to children's mental health. There are not firm dividing lines between different ages, but the type of impact varies somewhat according to the child's state of physical, cognitive, and emotional development. So we'll describe the principal reasons for concern at different developmental stages, from prenatal impacts to impacts on youth and young adults. Before birth, the potential for impact is really significant. As the fetus's physiological systems, including their nervous system, are developing, external stressors may have an impact that is severe and permanent. We have lots of research showing that prenatal exposure to extreme weather events has been linked to the later development of mental health problems such as anxiety, depression, or attention deficit hyperactivity disorder. High temperatures or air pollution both increase the likelihood of preterm birth, which is in turn linked to poor cognitive development and increased risk of psychiatric disorders. After birth, the infant is still vulnerable to these effects because their nervous system continues to develop. In addition, they can be affected by parental stress, by food insecurity, and by disruptions associated with extreme weather events or climate-related displacement. As children become toddlers and start school, they become more aware of impacts outside the family and can be strongly impacted by climate-related disruptions. There's evidence that children are particularly vulnerable to the mental health impacts of extreme weather events, for example, showing higher levels of PTSD than may be experienced by adults following such events. Heat and air pollution also affect children's mental health and their ability to learn. Adversity experienced at this young age can have a lasting effect on the brain, leading, for example, to long-term impacts on self-regulation and on learning. Displacement is especially difficult for children because during these early years, it's very important for them to develop a sense of stability and security. They're also dependent on parents or caregivers for almost everything, including food and shelter. Thus means that if their parents are experiencing extreme stress, even if the children themselves are not experiencing that stress, they will be affected by their parents' mental health. And research suggests that parenting style may be affected by the experience of an extreme weather event, and child abuse may increase as parents deal with the consequences of the changing climate. Adolescents and young adults are still subject to many of the same things as younger children, although their physiological and nervous systems are more fully developed, so the impacts, those direct impacts of extreme weather and heat may be reduced. Two things make this developmental stage of particular concern, however. One is that youth in this age group are increasingly aware of the fact of climate change and may experience higher levels of climate anxiety, due in part to the fact that they know they are going to face more of the long-term consequences of climate change than will older adults. Now, climate anxiety itself is not a mental health problem, but strong feelings of anxiety are associated with psychological distress, depression, and reduced well-being. In addition, youth of this age are making decisions that can affect their entire life trajectory. Research is still fairly preliminary, but we see increasing evidence that concerns about climate change are affecting the decisions children, young adults are making about parenthood, about their interpersonal relationships, and about plans for the future. Young adults report wondering whether they should have children because of uncertainties about the future. And this unpredictability in general may reduce their ability to make concrete plans to achieve their future life goals. As one youth activist said, how can we plan for the future when we don't know what that future will look like? I'd now like to turn the floor over to Aisha Netta Brown. Aisha Netta is the social media manager for Good Energy Stories and the Gen Z advisor for the Climate Mental Health Network. She became highly involved in climate advocacy as an adolescent and has especially focused on the role of storytelling and the visual arts in creating care and concern about the climate crisis. And we're so glad that she was able to contribute to this report.
Hi, everyone. My name is Aisha Netta Brown, and I'm so happy to be here with you all today. My work focuses on media, Hollywood, storytelling, research, and emotional intelligence. I like Susan mentioned, Dr. Susan mentioned, I work for Good Energy and the Climate Mental Health Network, and I got very, very involved in advocacy at a young age. As that developed, I realized that there was a lot of anxiety associated with the climate advocacy that I was doing. And I sort of took a step back and realized the power of storytelling. And so I turned to my creativity as a means to amplify messages of climate and mental health advocacy through writing, photography, visual arts. I really wanted to shed a light on the interconnectedness between the environment and our well-being, and infusing creativity into these pressing issues seems to engage a wider audience and ignite a sense of empathy and urgency. Within this creative storytelling, I realized that there's also this ability to spark conversations and evoke emotion to inspire action. And that is something that can be overlooked when you're overwhelmed and you really want to see things change. So this sort of creativity with climate serves as this bridge between scientific data and human experiences that fosters a deeper understanding of the impacts of climate change on mental health. And in sharing our stories, we must remember the importance of these emotions and their positive value. So I inspire to convey a message of hope and empowerment, particularly to young individuals who may be grappling with anxiety, grief, or overwhelming emotions due to climate impacts. And that is all I have to say today. Thank you so much for having me. So I will be passing this conversation on to Dr. Christy Manning, who is an associate professor of environmental studies at Macalester College and is an APA fellow and a member of Division 34 to discuss some solutions.
Thank you, Aisha and Netta. We are so lucky to have you on this team. Thank you for your wise words and your courageous, brilliant work. So in this next section, we're going to summarize what the research literature tells us about solutions that support childhood and youth well-being in the face of our changing climate. This research on solutions is growing rapidly. So what we have offered in this report and what I'll talk about right now is just a starting point. There are so many ideas out there, more and more every day. I'm going to begin by talking about the systems level solutions. So the most critical step we have to take collectively, all of us, to protect and enhance young people's mental health in the face of our changing climate is to dramatically reduce our greenhouse gas emissions. We've really got to address climate change at its root. That is just clear and unambiguous. In addition, we know that our past emissions are going to continue increasing climate impacts. There's going to be more extreme weather, greater heat, less predictability, and so on. So we also have to prepare our communities for these future difficulties that we know are coming. In other words, we need to help our communities become more resilient. So both of these mitigation efforts and adaptation efforts have to center the voices and the needs of fence-line communities, those who have already been burdened by climate impacts first and worst. We have to focus on environmental justice. As already noted by Susan earlier, communities that have been targeted for marginalization are much more likely to experience climate impacts, and they also have really good ideas born of experience for what all communities need to be resilient. So we need to listen to them and put their voices front and center. When it comes to infants, children, and youth, future health and well-being is really dependent on systems level meeting basic needs, especially during early development. To protect young people's current and future mental health, we have to ensure that everyone has access to clean water, nutritious food, a safe and stable home and community. And finally, at the systems level, we really need to pay attention to the access to mental health care. We need to expand and strengthen mental health care systems out there and make sure everyone can get the mental health care that they need. Next, community level solutions. So it's not unusual these days for a community to have a climate action plan. Community level, city, county, municipality level climate action plans do two things at once. First, they accelerate a community's support and accelerate a community's decarbonization through things like energy efficiency, renewable energy access, changes to transportation at the local level, and things like that. Climate action plans also help identify and plan ahead for, again, those climate-related risks that we know are already baked into the system in order to prevent harm and support everyone's well-being, which includes the well-being of children and youth. Of course, climate action plans are most effective in meeting young people's mental health needs when young people are involved. And so those climate action plans actually have provisions that consider young people from their own viewpoint, what they need. And in addition, these climate action plans are most effective, once again, when they put justice at the forefront. Therefore, local policymakers should really invite youth to participate in creating or revising their climate action plans. This not only brings an often overlooked youth perspective into the planning process, it also supports young people's mental health because it gives them the opportunity to help others. This is a really good psychological boost for anybody, and in particular young people. It's really important. So young people, the research shows, benefit from taking collective action. That can be things like joining a climate action planning committee, or helping to plan a neighborhood solar garden, meeting with others to talk about disaster preparedness, or helping out in the aftermath and supporting the community after an extreme event. There are also other kinds of collective action, like attending a climate march, that appear to buffer and protect youth mental health. And then the last community level solution that is definitely worth mentioning and talked more about in the report is expanding access to green space. Spending time in nature has so many positive well-being outcomes for children and youth and everybody. So we need to make sure that everybody can access green space close to their homes. Okay, moving on to school-based solutions. Children and youth spend a lot of time in school. So schools and also daycare settings for younger children are another really important place to build support for youth mental health. Solutions in schools start with the physical facility. Is the school or the daycare in a healthy building? Does it have good air quality or good filters? Does the building reflect good climate and energy principles, such as energy efficient lights and appliances, compost bins, shades to keep rooms cool and energy efficient? Are all those things in place in the facility? We also need to consider the school social environment. Are the teachers and other staff able to provide support to their students? Are they aware and knowledgeable about the climate crisis? Do they encourage caring social support networks among children when climate change as a topic comes up and even beyond that? And last, but certainly not least, school curricula impact young people's mental health and well-being. Many children first encounter climate change at school. So how are they taught it? Are they taught it in a hopeful, empowering, solution-oriented way, but also a realistic way that doesn't skim over the concerns, but presents them honestly, but then also empowers action? Does the school offer opportunities for children to engage in age-appropriate climate action? For example, getting involved in a community tree planting, or planning a solar array on the school property, or working on a divestment proposal to divest the finances from fossil fuels. Now, health professionals solutions. I saw on the chat quite a few health professionals out there in the webinar audience today. A shout out to you. Climate distress is a pretty new phenomenon. This makes it a challenge for our healthcare systems. It also means that there are really big opportunities for healthcare professionals to make a difference, both with individual patients or clients, as well as addressing the larger healthcare systems in which we all seek our health and well-being. So one of the first things that healthcare professionals can do is deepen their learning and training on climate change and its health and mental health impacts. And again, thank you, those of you who are here today, a shout out to you. In addition, healthcare professionals can help develop the tools and assessments that we need for early detection of problems in children and youth who are impacted by climate change. We don't have a lot of those yet. And early detection of things like climate anxiety or disaster-related PTSD, if those are caught early, they are much less likely to have long-term impacts on a person's mental health and well-being. So we need those assessments and those tools. Now, of course, not everyone needs an intense treatment for climate mental health concerns. Healthcare professionals can thus help build a wider range of interventions and advise on things like what's the right way to have a conversation, for a young person to have a conversation with a counselor, spanning on up to the much higher intensity options. What are all the things that we need in between? We have some ideas, but that all needs to be filled in, and healthcare professionals can help do that. And of course, healthcare professionals can help identify and contribute to new evidence-based treatment options, clinical interventions for young people and others whose climate mental health concerns rise to the level where they really are interfering with day-to-day life. And then finally, as you'll see in the report, we have a section on parents. The immediate family is the most critical source of support for children undergoing any kind of stressful event. And that includes thinking about climate change or experiencing a climate impact. So a child's main caregivers, parents, grandparents, other significant adults in their lives, really have to tend to their own well-being during difficult times. The caregiver needs to be well in order to support the young people in their lives. So this is, of course, easier said than done. But paying attention to it and doing what you can have truly huge ripple effects on young people's later well-being. So it's also important that community level entities, churches, other agencies and nonprofits, organizations, institutions in the community should provide support for parents and caregivers. This should really be a number one priority, especially during and after in the aftermath of disasters. Depending on age, children need different kinds of support. Younger children may just need someone to guidance in someone who can guide them in managing their fears and working with them to feel hope as opposed to despair. Older youth might just need someone to talk to who will take their concerns seriously, not downplay them, not say, oh, it's going to be okay, don't worry, but really listen to them and talk with them about it. The research shows that children whose parents and caregivers speak with them about climate change in solution-oriented ways, those children are more likely to adopt healthy coping mechanisms. Their approach to coping is better for their well-being, and this is connected to present and later good mental health. So thank you all. I'm passing it back to Megan.
Thanks, Christy. So you've just heard an overview of the impacts of climate change on children and youth mental health and the breadth of things we can all do to be part of the solution. We covered a breadth of it. There's much more in the report. And also in the report, we were intentional about helping us all go from understanding to action. And so in the next couple of minutes, I'll be covering a range of vetted resources that are available to you through the report. So parents and caregivers can begin by educating themselves on climate change and how to manage your own emotions and help your child build resilience and manage theirs too, as Christy mentioned. And there are specific resources to help, including Climate 101s and books on the topic. There are also resources to help parents talk to your children about climate change in age-appropriate ways, as well as websites that parents can visit with their children that offer engaging ways to learn. And as noted already, getting involved in climate action can be very helpful for our young people. So in the report, you will find a list of several organizations, many with chapters nationwide, that are dedicated to helping youth to connect with other concerned youth and elevate their voices and actions for climate solutions. We also have resources for educators, and shown on the screen are just a few of them. they can be used by educators and also in the classroom. So teachers and professors spend a significant time with children and young people. They can give support to students by providing age-appropriate education and hands-on learning opportunities. And the good news is that there's a growing number of guides, educational toolkits, and educational materials that you can make use of, offered by a range of organizations such as the American Public Health Association, government agencies like the EPA, NIH, and NOAA, and other nonprofit organizations. And they include guides, papers, videos, assignments, and so much more. There's also books available on the topic, including from psychologists and from affected youth themselves. And there are a burgeoning number of hands-on resources, including on self-care and taking action, for instance. And for you health and mental health professionals listening today, there are also quite a range of resources for you to consider as well. So including resources to get yourself up to speed on climate change generally, like from the IPCC. There are also mental health and climate change specific resources, such as a paper from Dr. Clayton on the climate anxiety scale, and also clinical psychological responses as well. And of course, the over 200 citations in this report alone are available should you be inclined to dive deeper in any of the topics. The American Psychological Association offers continuing education on mental health and climate. And you may be well aware that Division 34 engages on climate change as well. You can also get trained to speak with others on climate change through Climate for Health ambassador training. And there are links to organizations and efforts to take your leadership to the next level through patient education and policymaker advocacy. And what you've seen on these slides is just a sample of what is offered through the report. You can find links to all of the resources included in the report itself. So now we're going to move back to Q&A, back over to you, Ben. And if any of you have questions, please do put them in the chat.
Great, thank you, Megan. Yeah, we're really excited to go through some of the questions we've gotten in the chat. Please feel free to enter any more. In addition to all the co-authors and speakers you've heard from already, we're also joined by Scott Barstow, the Senior Director of Congressional and Federal Relations at the American Psychological Association, who will also be helping to field some of these questions. But I'll start with the easiest question that we got. Yes, we will be sharing the presentation out. We'll be sharing the recording out to everyone who registered. And please be sure to look out for emails and posts from us about ways to engage with this research and ways to advance it and connect it with your networks. We're really excited about this report, and we want to make sure that you have anything that you need to learn more from it and to start sharing it with your colleagues. So I'll start with one of the questions that came out from the chat on how some of these recommendations for school-based and educator solutions connect with broader educational strategies that are didactic or teacher-centered versus student-led and centered. So I'll offer that out to whoever wants to take a first crack at it.
I don't know, but I am really excited to learn more. And so I am grateful to the person, because I'm not familiar with those standards, but excited to read and make those connections. So thank you. I also saw that appear in the chat. I don't know if anybody else has a response.
I'm not an educator myself, but if there are some others who are watching right now and have a response to that, please feel free to answer each other as well in the chat and share your ideas. We'd love to see them.
Great. And I think that some of this came during the discussion, but we one question that we heard was more information about about the relationship between parents' mental health and children and youth mental health issues.
Yes, I think just the big picture response to that is we tried to call attention to the existence of that relationship. So you might think that if children themselves have not experienced some of these effects directly, they've been protected from that, or maybe children are so young they're not aware of these external events that are happening, that they might not be affected. But in fact, because children are so strongly affected by their parents' mental health, even before they're born, and certainly up to young adulthood and beyond, if the parent is stressed out or their mental health is otherwise impaired by their direct experiences or just their concern about climate change, that may well be reflected in their parenting skills. Sort of worst case scenario, a high level of stress could lead to a child abuse. A high level of anxiety might just lead a parent to be less available, either sort of directly or emotionally available. So there's so many ways in which parents' mental health is going to have a carry-on effect on their children.
And I think it's something that I've heard a lot from people, that they're concerned about climate anxiety and making it worse for young people. So kind of what are some of the different approaches? I think we've covered some of this during the presentation, but a little bit more detail or examples of how to engage children and young people in climate conversations and actions that help to address that anxiety without making it worse.
Yeah, I'll jump in, and then maybe Christy would also like to add, because I think both of us get this question a lot, parents who really want to know how to bring this topic up with their children. And I think a common response is to think, I don't want to make my child nervous, so I'm going to avoid the issue. I don't want to scare them. But that's not a good approach, because really, from a very young age, children are going to be hearing about climate change. They're going to be seeing reference to it. They may be, of course, directly experiencing it, but even if they're not, they're hearing about it from their peers and their teachers and their older siblings. So I think the most important thing for parents is to be honest with their children and to respect their feelings and validate them. That idea of validation is something that we hear a lot. Of course, you also want to be mindful of the developmental stage of your child and not terrify them. So combining an honest acknowledgement of the problem with some reasons for hope, and even at a fairly early age, I think children can be given some way to engage positively with the problem. Encouraged to help reduce energy use in the home, or as some of the examples Christy shared, as ways in which they can get involved in the schools and the community. So yeah, let me pass that on to Christy and see if she wants to add some more examples.
I would add, well, ditto everything Susan said, and also add that every child who has a parent or family members, other adults who speak with them in these honest and hopeful, encouraging, proactive coping sorts of ways, that child is then going to be the child in school when other children are expressing concern about climate change. That's the child who's going to say, oh, but you know what? We can do this. And so you are not only helping your own child cope by having these honest conversations and encouraging a solutions-oriented attitude toward climate change, you're creating a little ripple effect in that child's social world. And we all need to talk about climate change more. We simply don't. And so giving children the tools to be a node for a hopeful approach to climate change is a really powerful act.
I also would like to add, so I just recently got back from Germany from being a guest researcher at a university, and I shared a climate anxiety film that I was a part of last year. And one of the observers of this film came to me after this presentation and said, I'm scared to show my kids this, who are 15 and 16, because I'm scared that it will have some negative impact on them. And, I'm not a mental health professional, but I reassured him that the best thing to do, the best way to approach it is just to tell the truth. And this film is with people who are somewhat around your kid's age, talking about their experiences and how they outlet that and how they deal in healthy ways with that, So I would just say again, like seconding Susan and Christy, like it's the honesty, age appropriate honesty, and just being right there by their side, however many steps along the way that they need you to be there.
Great. And I think our next question zooms out a little bit to the policy level. We've gotten a couple different versions of this question, but any recommendations for policies that can support youth mental health, can address some of the health inequities tied with climate change and especially mental health? And I can flag out to Scott and Megan to take a swing at this first.
We could have an entire webinar devoted to that topic. I think it's safe to say. So, I mean, one of the difficulties that we confront at APA is the fact that even aside from climate change, as Dr. Evans is pointing out, there's been a youth mental health crisis going on even before COVID, and COVID just exacerbated it. So it's kind of like trying to fly the plane while you're building it, almost kind of. But certainly climate anxiety needs to be part of what is addressed by a new, improved, strengthened youth mental health system. Megan, I don't know if you would have anything specific to add.
Well, I would add, I think both our organizations are signatories to the Community Mental Health and Resilience Act that's going through Congress at this time. And that was partly informed by the research we did in 2021, partly informed by youth themselves. So it really takes the recommendations from this report into account. And so, I mean, that, I would start there. I would look there, but I also would look at policies, of course, as Christy mentioned earlier, that tackle climate change at its root, because we have to help folks now, but we have to be keeping an eye on that 2030 date where we really need to have the reductions in place to maintain a stable climate.
One thing.
Oh, sorry. Go ahead, Scott.
One opportunity might be to focus on just school system itself. Like, are you going to school as a student in a net zero school? Those exist. I mean, there's one just up the road from me in Arlington, Alexandria, where I live, just down the road a little bit. I think we're just starting to open one, but from this point forward, school should be net zero. That's something people know how to do. So yeah, there's so much work to be done, but we need to start now.
And this is another question I've heard a lot from both public health folks and educators about resistance to institutional resistance to bringing up climate change, to even using the phrase climate change, and that this can be a real challenge when trying to bring it into the public school system, as well as a public health professional talking about climate change and health impacts. Megan, I know that you've dealt with this a lot as well, so I'll let you start the answers off here.
If we just take a look at this year that we're in right now, we've set so many records for heat alone, let alone billion-dollar weather disasters, and so many different climate-related extreme weather events. And so it's very few communities that haven't been touched by climate impacts. And so what we always suggest is really ensure that we're talking about reality, what people can see with their own eyes, what they're experiencing directly. Start there, start personal. You don't have to label it climate change right off the bat, but it is important to bring climate change into that conversation once you have a common understanding with folks. That because the reality is, as health professionals, that we're all on the front lines of this issue. And so it is our reality, and it is folks' reality in communities across the nation. And so starting there with what we're feeling, seeing, experiencing, and then moving into what we can do about it, really helps people get over that sort of hesitancy of the topic. because you're seeing them and you're acknowledging what they're experiencing. And also by talking about climate change, you are bringing forward all of those people who I spoke about earlier, who assume that no one around them is concerned about climate change when they in fact really are. And so I think you'll have more relief when you talk about this than pushback. It just, sometimes the folks who push back are a little bit louder, but you should persist.
Does anyone else have anything to add on that one? All right, then we're going to jump over to a question on climate and youth mental research on this subject. Kind of do especially our authors have thoughts about the areas of greatest need or gaps in knowledge and evidence that could be filled in?
I can start. One of the things I think that is something people are very interested in and have only started paying attention to recently is, again, this idea of climate anxiety, the worry and stress and concern associated with just awareness of climate change. And I think two really important issues are what helps people deal with this kind of anxiety. So what are the best evidence-based tools for helping people cope in the face of these additional sources of stress? Those probably differ a little bit from tools for just dealing with anxiety in general. And then second, as Christy mentioned, there's evidence that getting involved, getting engaged with doing something about the problem can be one way in which people can cope with their climate anxiety. So I think we really need to know when is anxiety actually a useful motivator for effective action that not only helps address the problem, but also helps mental health. And when does it become a real source of stress and in fact a threat to mental health? So what determines which of those two tracks it follows for a particular individual?
I would echo all of what Susan just said and then also emphasize this. We know that we need to take collective action on this issue. And it does appear that worry and a sense of anxiety is a motivator among other emotions. But there does also seem to be this the sort of narrow corridor of emotion where too much anxiety may lead to paralysis, not enough concern leads to inaction, and we don't really know. We know a little bit about the boundaries of that. And then the other thing that Susan also mentioned and that I'll highlight again is there are many people working on, okay, what sorts of treatments, or even treatments is too strong a word, what kinds of interventions are out there to support people. And so we really need more people doing research on evidence-based approaches to supporting people who are feeling this sort of more extreme levels of climate concern and anxiety. So thank you.
Thank you all so much. I feel so energized even just looking at the chat here. It isn't just questions coming in about the research. People are sharing resources. They're sharing their personal stories about how their work in nature has helped their families, children that they care about. And then, of course, there's been the incredible work in Montana and many other states where children have led and led in really and won significant victories to protect their health through climate action, to get recognition that this climate crisis is affecting their health. So we will be going through the rest of these questions that came in through the chat. If you have any other questions that were not answered today, please feel free to reach out to us at research@ecoamerica.org. We really do want to make sure that we are making sure that this research, that these resources are something that you can use in your work and that you can use in your personal life as a member of a community, as a family member, so that we can continue to advance this work. And coming up, we at Eco America are truly excited to announce the launch of a new awards program for climate active high schoolers. So we have now launched the American Climate Leadership Awards for high school students, and this awards $125,000 to high school students, clubs, classes, teacher-sponsored programs, and student-led nonprofits with proven success, broadening local participation and building public engagement or political will for climate action, advocacy, preparedness, or resilience. Really, if there are high school students that are doing exciting work on climate change, they should nominate themselves. You should nominate them for these awards. The submissions will be judged by peers, recent graduates, youth climate leaders, and climate advocates. And this can range in scope from in their school, in their classrooms, to the neighborhood, city, state, or national. Nominations are due in just a few weeks on November 1st, and then final applications are due December 15th. And I'll also note for adults that we're not leaving you hanging. We're having the 5th year of the American Climate Leadership Awards, another $175,000 in awards, similarly for adults who are taking meaningful leadership on climate engagement. So please go to the American Climate Leadership Awards. The links are here in the chat. Nominate the kids and adults in your life that are taking action on climate change to move forward. So I want to thank everyone again so much for tuning in today and for all of your ambitious climate action that supports physical, mental, and community health and equity. We truly appreciate you, and we're looking forward to supporting your leadership. Please join me in caring for ourselves to take care of the planet. See you soon.